Welcome to the We Level Up Treatment Center video series. In today's video, we will discuss Dilaudid Side Effects. What is Dilaudid? Dilaudid is an opioid analgesic pain prescription drug synthesized from morphine to create a potent hydromorphone drug. We know it by the brand name Dilaudid. It helps people who suffer from severe pain, but also puts them at risk for abusing the medication. Dilaudid is sold in immediate release tablets, oral solutions, and intravenous injections. The Drug Enforcement Administration, DEA, lists hydromorphone as a Schedule II controlled substance, meaning it has a high potential for abuse and a high chance of causing dependency. Dilaudid addiction means that the person physically and psychologically needs the drug longer than they feel the pain from their injury. This dependency affects all aspects of their life, including family, school, work, and community life. According to the National Institutes of Health, certain drugs can change the structure and inner workings of the brain. Repeated use affects a person's self-control and interferes with the ability to resist the urge to take the drug. For instance, being unable to stop taking Dilaudid, even though you know the side effects of Dilaudid abuse, is the hallmark of addiction. Medical professionals typically prescribe Dilaudid for pain related to cancer and other serious injuries, such as severe burns or multiple fractures. Like other opioids, hydromorphone works by interacting with parts of the brain in charge of pain. Opioids also affect parts of the brain responsible for motivation and happiness. Some people misuse the drug as Dilaudid side effects can get you high, and the large doses overwhelm the brain's pleasure center. The action of Dilaudid takes effect within 15 minutes, and its pain-relieving effects last up to 6 hours. Dilaudid is habit-forming and is commonly abused amongst consumers for its potent euphoric effects, which have been described as being similar to that of heroin. Dilaudid side effects can range from mild to severe. However, you should never ignore any of them. Recognizing the hydromorphone adverse effects puts you on the path to helping your loved one seek prescription drug addiction treatment. What are the most typical Dilaudid side effects? Dilaudid side effects include nausea, vomiting, constipation, sweating, flushing, or dry mouth. Constipation. To prevent constipation, consult with a healthcare professional and consider consuming more fiber, drinking more water, and exercising. Dizziness, lightheadedness, and drowsiness. To decrease the risk of lightheadedness and falling, get up gradually when rising from a seating or lying position. What are the common long-term effects of taking Dilaudid? If taken regularly for a long time, hydromorphone or Dilaudid side effects can induce physical dependence and addiction to the drug. This means your body becomes more and more tolerant of the drug, requiring an ever-increasing dose to function. Eventually, higher doses to get the same pain relief lead to reliance and addiction to the drug. You may feel Dilaudid withdrawal symptoms when you stop taking the drug. How long does Dilaudid pain medication last for? The painkiller activity generally lasts for better than 5 hours. Similar to other opioids, hydromorphone or Dilaudid produces euphoria or feelings of peace, diminished anxiety, respiratory depression, sedation, papillary constriction, and even cough suppression. How strong is Dilaudid for pain relief? Dilaudid is approximately 8 times stronger than morphine. The drug Dilaudid is a highly powerful opioid painkiller that should only be dispensed to people who have shown that they can tolerate opioid medications. Is Dilaudid an opioid? One of the most common questions about Dilaudid is whether it is an opioid. Yes, Dilaudid is an opioid. Hydromorphone is considered a semi-synthetic opioid agonist that was derived from the drug morphine. Like other opioids, hydromorphone works on the central nervous system to relieve pain. Dilaudid will be positively identified as an opiate if you undergo a drug test. Compared to other opioids, hydromorphone is very potent. The dangers associated with Dilaudid addiction are real and potentially deadly. Many individuals addicted to opioids like Dilaudid begin with a legitimate prescription. As opioids help users deal with pain, it is not unusual for individuals to keep using the drug even after the prescription period. This can build tolerance for the medication, meaning they will need a higher dose to get the same level of pain relief. This increased tolerance for prescription drugs and chronic use can lead to addiction. Is addiction one of the Dilaudid side effects long-term? While substance abuse can develop from legitimate hydromorphone prescriptions, it is possible to get addicted if the drug is used for recreational purposes. Some individuals abuse leftover Dilaudid in their home's medicine cabinets or buy the drug from illicit sources. The problem with sourcing the drug outside of a pharmacy is that there is a risk that the drug is not really what you think you're getting. Many opioids sold on the street are often laced with synthetic opioids like fentanyl. These potent synthetic drugs can quickly cause a drug overdose and even death when taken or abused. Popular Dilaudid street names. Street names for Dilaudid usually highlight a particular aspect of the brand involved in terms of its effects, color, or form. People use street names to hide their drug activity from others. How does Dilaudid affect the body? Respiratory depression. Dilaudid affects the respiratory center in the brain through action on the opioid receptors. This induces a slowing down of respirations, and the breathing pattern can become irregular. This can result in reduced gas exchange with elevated carbon dioxide and oxygen levels in the body. Overdose of Dilaudid can also cause respiratory arrest, the feeling of high and addiction. In altering the perception of pain in the brain, Dilaudid promotes more dopamine in the brain. Increased dopamine in the brain produces a high feeling by interacting with the brain's reward circuit. This feeling of high, experienced by the individuals on Dilaudid use, becomes highly desirable and thus adds to the potential for addiction to Dilaudid. This makes Dilaudid one of the most commonly abused drugs. Tolerance and addiction. Individuals taking Dilaudid at a recommended dose for a prolonged time develop tolerance to the drug and experience blunting the therapeutic response to Dilaudid at that dose. Diminishing therapeutic response prompts an individual to increase the dose of medication intake to derive the desired effect. This sets the cycle for addiction and abuse. Withdrawal syndrome. Reducing your dosage gradually over time is the preferred way to quit Dilaudid. Sudden Dilaudid withdrawal may induce unpleasant sensations, such as nausea, vomiting, intense muscle aches, sleep disturbances, abdominal cramps, and diarrhea. How does Dilaudid affect the brain? Hydromorphone, one of the main chemicals found in Dilaudid, is a full opioid agonist affecting the mu-opioid receptors. So what happens in the brain when you take Dilaudid? When you take Dilaudid, the hydromorphone binds to mu receptors, creating analgesia. It also causes pain relief. Although the precise mechanism of the analgesic action is unknown, opioid receptors throughout the brain and spinal cord are thought to play a key role in the analgesic effects of Dilaudid. Dilaudid is also known to cause respiratory depression, directly affecting the brain system's respiratory centers. Respiratory depression is a state of reduced brain responsiveness to increases in blood gas tension and electrical stimulation. Finally, Dilaudid is known to cause excessive constriction of the eye pupil, even in total darkness. Pinpoint pupils are usually the first sign of an opioid overdose. Why does Dilaudid cause itching? Itching is a possible side effect of Dilaudid for certain users. Dilaudid itching can be severe in some cases, with users reporting severe itching all over their bodies. Those who experience it commonly ask, why does Dilaudid make you itch? Unfortunately, the exact reasons are not clearly defined. There may be treatment available to alleviate itching discomfort. For example, Phenergan is a commonly prescribed medication for itching. However, taking Dilaudid with Phenergan is not recommended since it can increase Dilaudid side effects like confusion, dizziness, and drowsiness. This combination can also cause several other adverse effects, with the potential for new Dilaudid side effects to develop over time. These include pneumonia, constipation, dependence, and hepatic necrosis. Dilaudid detox. We need to be transparent about the topic of detox. It will not be an easy process. A person will likely experience many different Dilaudid side effects from their drug use. These Dilaudid side effects may be emotional, physical, or mental. Unfortunately, for those with dependency, detox is an unavoidable first step to recovery. We Level Up NJ addiction specialists are standing by to help. That's it for today. Please subscribe and hit the notification bell. Like, share, and comment. We would love your feedback. Have a great day.